Hey friends, if you're a new doctor or nurse just starting in pediatrics, you've probably realized one truth. We have to calculate everything. Unlike adult medicine, where you often have standard doses for everyone, children have different ages and size, and therefore we have to calculate every drug dosage, every fluid boluses, or even vital signs change depending on age. This huge variability makes the initial learning curve in pediatrics very steep. Sometimes you may look at the blood pressure monitor and honestly not knowing if that child is stable or about to crash. It is completely normal to feel anxious or overwhelmed when you are just starting out. Therefore, I made this video to walk you through the 4 most important formulas you must memorize. These are the basics that will save you and the child during an emergency when your brain freezes up. By the way, if you're new here, I'm Dr. Oliver. I'm a pediatrician with over 10 years of experience working in general PEDS, the pediatric ICU and the neonatal ICU. I created this channel Paediatric Squad to build up a community for healthcare providers just like you, so we can flatten that steep learning curve together and help you feel confident on your next shift. If that sounds like the support you need, please consider subscribing. Okay, now let's get to work. Formula number 1. So let's start with the most critical vital sign, blood pressure. In adults, we know that 90 is the borderline systolic blood pressure. But in kids, that number changes as they grow. In children, the minimum systolic blood pressure is 70 plus age in years times 2. So for example, if you have a 4-year-old patient, you take 70 and then you add 4 times 2, which is 8, giving you 78. And therefore, if this 4-year-old has a systolic blood pressure lower than 78, they are hypotensive. However, I need to remind you that this formula has lower and upper limit. For lower limit, let's take a look at the base number, 70. That means for any infant, excluding the neonates, 70 is the absolute floor. Less than 70 is never okay. For example, if you have a baby with 8 months old, we expect the systolic blood pressure to be greater than 70. And how about the upper limit? So we don't use this formula forever. So once if we apply the formula and the result is above 90, we stop. Because 90 is the borderline adult systolic blood pressure. So if the formula say 90 or higher, just use 90. For example, a 13-year-old teenager, we don't expect to use the formula and say his limit is 96. Instead, we kept the limit as 90 by using the adult rule. Formula number 2. Now you have identified a child with hypotension and you're thinking about the cause and would like to treat them. So most of the time you can treat them with fluid bolus. And the standard formula for fluid bolus is 10 to 20 ml per kilo. So we can either use the normal saline or the lactate ranges. Let's take a 25 kilo child. 25 times 10 is 250 ml. So you can infuse this typically over 30 minutes to restore the volume. However, here is a practical rule I use. I usually will cap the maximum fluid I give each time at 500 ml because a standard adult bag of like NS is 500 ml. So even if you have a 60 kilogram teenagers, you can just start with 500 ml first, one bag, and then assess the response, and then decide whether you need another bag later on. Here, I need to remind you one important thing, the causes of shock. So if you're suspecting the child is having hemorrhagic shock, which means they're having a severe bleeding, consider giving packed red blood cell at 10 ml per kilo. But if you suspect the child is having cardiogenic shock, which means the hypotension or the shock was due to the heart problem, you must be extremely careful. If you blindly give fluid into a failing heart, you will cause pulmonary edema and then drown the lungs. The child may go into severe difficulty in breathing. And therefore, always be aware of the possibility of cardiogenic shock before you give the NS bolus. How? Look at the history. Did they have a recent viral illnesses with chest pain? Think about myocarditis in this case. Do they have known congenital heart disease? Or on physical examination, do you feel a hepatomegaly? Sometimes, if the child is very tachypneic or having severe tachycardia, and when you listen to the chest, it's clear it's unlikely due to the lung, do think about it is a case of heart failure. So in these kind of cases, you need to be careful before you give the fluid bolus. So in these cases, do not give 20 ml per kilo. Start smaller, like 5 to 10 ml per kilo, and it goes lower. Infuse over 1 hour. And also listen frequently. Check for any basal crepitations over their lungs. If you hear the basal craps, stop the fluid. Usually in these children, we often need inotropes to help the heart, but not just fluid. So be careful, be always aware of the cardiogenic shock before you give the fluid bolus. Formula number 3. So we have covered circulation. Now we must talk about the airway. This brings us to formula number 3, the endotracheal tube size and the depth. For cuff tube, the formula is H divided by 4 plus 3.5. And for uncuffed tube, the size is slightly larger. It's H divided by 4 plus 4. And for the depth of the intubation, we take the depth at the lips. So we calculate by H divided by 2 plus 12. Or you can simply multiply the internal diameter of the tube size by 3. So for example, if you have a 5-year-old child, the cuff tube size is 3 divided by 4 plus 3.5. So you have a number of 4.25. You can go for the nearest one, which means 4. So your cuff tube size is 4. For the depth, it's equal to the internal diameter times 3, so which equals to 4 times 3, 12 cm at least. But here, I want to be very honest with you. So when you design a child who needs to be intubated, the atmosphere in the room usually changes instantly, and your adrenaline is going to be sky high. It becomes very difficult to do the mental health. So my advice is this: if you have a bolus tape or a reference chart on the wall, use it. Just take the reference of the tube size and the depth there. Always verify if you can. But however, for whatever reason the chart is not there, this formula can help you save a life. Now we have covered 3 formulas. So if you are worried that you can't remember all these formulas, I have put together a simple pediatric survival formulas PDF, and it's linked in the description below. And we have some more other essential formulas that you need to know as a pediatrician. So you can print it out and slip it into your scrub pocket, or just save it on your phone so it's always there if your mind goes blank. Let's go to formula 4. We have talked about hypotension, airway, and there is one last very important formula you must remember during resuscitation: the shock energy during CPR. When the child is in cardiac arrest, you need to check if they have shockable rhythm. If they are having pulseless VT, ventricular tachycardia, or ventricular fibrillation, VF, you need to have defibrillation. And the formula of the shock energy goes like this. The first shock, we start with 2 joules per kilo. And the second shock, if that fails, increase to 4 joules per kilo. And if it still fails, still have the shockable rhythm, the subsequent shocks will be at least 4 joules per kilo, and it's up to maximum 10 joules per kilo or the other dose. However, if the child has unstable SVT or VT with pulse, you need synchronized cardioversion instead. First, you must press the synchronize mode button on the defibrillator. This is very important because if you don't press it, it can stop the heart completely. Okay, so the dose of cardioversion is like this. We start with a lower energy, 0.5 to 1 joule per kilo. And if it doesn't convert the rhythm, we can increase to 2 joule per kilo. These are the 4 core formulas I want to share with you today. I know how it feels when you're just starting in pediatrics and there's just so much math. Do check out in the description box for the PDF if you just want something on your phones or in your pocket. Just print it out and then you can take reference anytime. There is also one small pro tip I want to give you from my experience. Always carry a small physical calculator with you. And it's often faster and easier to use with gloves on other than a touch screen on your phone. And also unlike your phone, it won't out of the battery in the middle of a shift. Always bring a physical calculator, it's very useful. And I also want to remind you one thing. If you are really struggling to memorize this number right away, doesn't mean that you are not suitable in doing pediatrics. You have worked incredibly hard to become a doctor or a nurse. You're brilliant and you're good enough to be here. So I can reassure you that the muscle memory will come with time. Be patient with yourself. You can do it. I will see you in the next video.